in the previous class we have discussed about shock. So shock is one of the major conditions which is related to cardiovascular disorder, or else it is related to cardiovascular system. So let us see, in this class we will discuss about vasopressors. So what are vasopressors? So vasopressors are the drugs which are used to elevate mean arterial blood pressure. So vasopressors are the agents. In simpler words, we can say vasopressors are the agents which causes vasoconstriction. Because of that vasoconstriction, mean arterial blood pressure is increased. So what is this mean arterial blood pressure? So mean arterial blood pressure is the average pressure which is created or generated in the arteries in one cardiac cycle. So in one cardiac cycle, there occurs contraction as well as relaxation of both arterioles and ventricles. So during the contraction period of these arterioles or arteries, the pressure which is generated, the average of the pressure which is generated in the arteries is called as mean arterial blood pressure. So these vasopressors, because of the vasoconstriction, they increase the mean arterial blood pressure. So these vasopressors are mainly used in the treatment of shock. Why? Because in shock, there occurs vasodilation for longer period of time, leading to the paralysis of the muscle. So in order to prevent the various kinds of shock, these vasopressors are used in the treatment of shock. Here we can see the condition that the normal systolic or else the normal blood pressure is 120/80, where 120 is systolic pressure and 80 is diastolic pressure. If the systolic pressure is decreased greater than 30, see 120 is normal systolic pressure. So if it is reduced to greater than 30 units, for example, if it is reduced below 90, if the systolic pressure is below 90 degrees, below 90 mm of Hg, then it leads to, or else if the mean arterial pressure is less than 60. So if the normal mean arterial pressure, if it is reduced to greater than 60 units, then this vasopressors, or else it leads to various conditions of shock. So in order to prevent this condition, these vasopressors are used. What are the commonly used vasopressors? So the various drugs which are used as vasopressors are the adrenergic agents, phenylephrine, norepinephrine, epinephrine, dopamine, dobutamine, isoproterenol, and vasopressin. So there are various adrenergic agents or else adrenergic agonists which are used as vasopressors. Apart from that, there are various neurotransmitters which are synthesized in the body. For example, epinephrine, norepinephrine, adrenaline, serotonin, dopamine. So these are various neurotransmitters or chemical mediators which are generated in the body. So these out of these neurotransmitters, noradrenaline, epinephrine, and dopamine are used as vasopressor agents, because these neurotransmitters, when they bind to their particular receptors, they exert various kinds of action. So in order to antagonize particular cardiovascular events, these vasopressors are used. In adrenergic system, we have two different kinds of systems again, that is alpha adrenergic system and beta adrenergic system. So these adrenergic systems are divided based on the type of receptors they contain. So in alpha adrenergic system, we have alpha receptors, where these alpha receptors are further classified as alpha 1 receptors and alpha 2 receptors. And beta adrenergic system contains beta receptors, where they are categorized into beta 1, beta 2 as well as beta 3 receptors. So what are the various kinds of the effects? What are the various effects which we can observe on the stimulation of these alpha receptors are? One is the increased vascular tone. So if the neurotransmitters, adrenergic neurotransmitters like epinephrine and norepinephrine, when they bind to alpha receptors, they increase the vascular tone, or else we can say they increase the contractility, or else the movement of the vasculars can be increased because of the action of alpha receptors, and it may decrease cardiac output. So the cardiac output is nothing but the amount of blood which is or else the amount of blood where the heart pumps in one cardiac cycle per minute is called as cardiac output. So this cardiac output may be decreased because of the alpha adrenergic system stimulation, and it may decrease a regional blood flow. The blood flow mainly in the kidneys, spleen, in the cutaneous region and in the renal region, the blood flow may be decreased in that particular area because of the alpha adrenergic system stimulation. And what are the effects of beta adrenergic system stimulation? So in beta adrenergic system, the blood flow is not altered. The blood flow is maintained in a constant way, but it decreases cellular metabolism. So the various metabolic reactions which are occurring in the cell can be decreased because of the beta adrenergic system. For example, we can say fatty acid metabolism, glycolysis cycle, TCA cycle. So these are various metabolic reactions which are occurring in the cell. So this cellular metabolism can be decreased because of beta adrenergic system stimulation, and it may decrease immune system. So the immune system functioning may be decreased. So here this is the pictorial representation of sympathetic innervation. So this adrenergic system comes, or else we can say this adrenergic system is also called as, it involves two types again, sympathetic and parasympathetic. So because of the stimulation of this sympathetic system we can say it is also called as adrenergic system. So the nerves which are generated from the sympathetic system, it is distributed to the various organs like eyes, salivary glands, heart, lungs, liver, kidney, intestine. We can say all over the body sympathetic innervation can be observed, but the effects which are caused because of that particular organ differs. For example, because of the sympathetic innervation, there will be increased heart rate and increased contractility of heart. Whereas when coming to renal system, it causes increased adrenal gland stimulation, where it leads to aldosterone activation in the kidneys. So the action or as the effect of the sympathetic system differs from the organ to organ. So the other system which is affected by these vasopressors are dopaminergic system. So dopamine. So we saw dopamine is one of the vasopressors, one of the drug or neurotransmitter which is used as a vasopressor. So this is the natural neurotransmitter which is synthesized in the body itself. So this dopamine, once it is synthesized in the body, it goes and binds to the dopamine receptors and exerts its actions. So this system is called as dopaminergic system. So this dopaminergic system, what does it do? It increases splanchnic as well as renal perfusion. So especially in the renal as well as mesenteric region, the perfusion or the movement of the components, the movement of the molecules inside the cell, where that process is called as perfusion. So the movement of molecules inside the cell from outside will be increased because of the dopamine action. And apart from that, it facilitates resolution of lung edema. So the lung edema, the edema which is caused or the inflammation which is caused because of the lungs can be altered by the dopaminergic system, and it is associated with harmful immunological effect. So because of the dopamine action, various harmful effects or various harmful causes or effects which are caused to the immune system can be reduced because of the dopamine, and it may decrease the hormones like prolactin and growth hormone. So here we can see the pictorial representation. See, the dopamine is synthesized from an amino acid called as tyrosine. So because of the action of an enzyme called as tyrosine hydroxylase, dopa is formed. And because of from this dopa, the dopamine is formed because of the enzyme called as dopa decarboxylase. So this is the synthesis of dopamine, and once the dopamine is synthesized, because of the enzyme called as MAO, MAO, that is called as monoamino oxidase enzyme. So the dopamine once formed, because of the action of MAO enzyme, it is getting degraded or it is getting metabolized to dopac. So dopac is a compound which is formed because of the metabolism of dopamine. So once the dopamine, before going into metabolism, once it is formed, it will bind to the dopaminergic receptors and exerts its actions. So these dopaminergic receptors are G-protein coupled receptors. So what are these G-protein coupled receptors? So G-protein coupled receptors are the receptors which is mediated by the action of cyclic AMP or cyclic GMP. So this G protein coupled receptors on the activation of cyclic AMP. If there is an increase in the cyclic AMP, it causes effects like vasodilation, decreased heart rate, decreased contractility. If it causes increased cyclic AMP, decreased cyclic AMP levels, it causes vasoconstriction, it causes increased heart rate and increased contractility. So the effect of cyclic AMP is determined by this G protein coupled type of receptor. So dopaminergic receptors are GPCR kind of receptors. So this dopamine, when it binds to the particular receptors, it exerts its actions. Let us see the receptor physiology or the location of the various adrenergic receptors. As I told you, alpha receptors are of two types, alpha 1 receptors and alpha 2 receptors. So mainly alpha 1 receptors are affected as, or else we can say alpha 1 receptor agonists are used as vasopressor agents. So these alpha 1 adrenergic receptors are located mainly in the vascular walls, in the walls of the various arteries or veins or blood vessels, and it is also located in the heart. So, if alpha 1 receptors are stimulated, if adrenaline and noradrenaline or epinephrine and norepinephrine, if they bind to alpha 1 receptors on the vascular system, it causes vasoconstriction, or we can say constriction of the blood vessels takes place. If they are acting, if they are binding to the alpha 1 receptors on heart, it causes increased duration of heart contraction, or we can say the contraction of heart, or else the duration of contraction of heart can be increased. And beta receptors. So here the epinephrine as well as norepinephrine, they bind to both beta receptors, that is beta 1 receptors and beta 2 receptors. So beta 1 receptors are present in the heart and beta 2 receptors are present in the blood vessels. So what is the effect of these beta 1 receptor stimulation? If the beta 1 receptors on the heart are stimulated, it causes increased inotropy and chronotropy effects. Increased inotropy and chronotropy in the sense increased heart rate and force of contraction of heart will be altered if the beta 1 receptors in the heart are stimulated. And whereas in blood vessels, it causes vasodilation. The dilation or else relaxation of the blood vessels take place. And dopamine. So dopamine, if it is acting on the dopaminergic receptors, there are D1, D2 as well as D3 type of receptors. So dopamine will bind to all the three receptors and exerts its actions. So these dopamine receptors are present mainly in the renal region, in the splanchnic or mesenteric region, in the coronary region as well as in the cerebral region, in the brain, heart, renal or kidney region and mesenteric region. So if it is acting on the renal system, on these various systems, it causes dilation of the blood vessels. So what about the blood vessels which are present in these systems, it causes dilation of that blood vessels. Whereas in few other organs like liver as well as in the respiratory system and various other regions, it causes vasoconstriction. Here we can see the pictorial representation of noradrenaline effect. So noradrenaline, once it is synthesized in the body, it is released from the synaptic vesicles into the synapse, whereby it go and bind to alpha 1, alpha 2 as well as beta 1 receptors and exerts the various actions depending upon the location of the receptors. So here alpha 1 receptors, if the adrenaline or noradrenaline, if it binds to the alpha 1 receptors, because of the action of phospholipase C enzyme, there will be increased calcium, increased cyclic AMP levels, where it causes increased calcium content in the blood, where it causes smooth muscle contraction. Whereas when coming to alpha 2 receptors, if alpha 2 receptors, they are acting in a two-way. If they bind to alpha 2 receptors directly, the calcium levels will be elevated, leading to the inhibition of transmitter release, or else we can say the transmitter signals can be inhibited in that particular alpha 2 action. And apart from that, because of the action of an enzyme called adenylyl cyclase. Adenylyl cyclase is an enzyme where ATP is converted into cyclic AMP. If cyclic AMP increase, or else if there is any increase in the cyclic AMP levels, then it causes smooth muscle contraction. And when coming to beta receptors, here also adenylyl cyclase, it converts ATP to cyclic AMP, where it leads to heart muscle contraction and smooth muscle relaxation. Let us see the individual drugs of vasopressors. So first drug is phenylephrine. Phenylephrine is one of the adrenergic agonists. We saw the first category of vasopressors as adrenergic agents. So phenylephrine is one of the adrenergic agonists. So mainly it acts on the alpha receptors of adrenergic system. So this phenylephrine is an alpha receptor agonist and it is a potent vasoconstrictor. So once it binds to the alpha receptors, it causes the constriction, or else we can say it is very effective in constricting the vascular blood vessels. And what are the effects? What is the effect of phenylephrine on heart? So it causes bradycardia. Bradycardia is a condition where it causes increased heart rate. Bradycardia is a condition where it causes decreased heart rate. If the heart rate decreases, then it leads to a condition called as bradycardia. So if phenylephrine is used, the heart rate can be decreased, and apart from that, there will be decreased cardiac output. What are the uses of this phenylephrine, or else where this phenylephrine can be used? So this phenylephrine is mainly used in epidural as well as spinal anesthesia conditions. So when a spinal anesthesia and epidural anesthesia or analgesia condition, this phenylephrine is mainly recommended. Apart from that, if there is excessive vasodilation, if there is any excessive relaxation of vascular smooth muscle, this phenylephrine is recommended as it is a potent vasoconstrictor. And when agents with beta adrenergic activity cause tachycardia. So as I told you, phenylephrine, it causes, or else it produces cardiac effects like bradycardia, right? There will be decreased heart rate. If there is any excessive increase in the heart rate, or else if there is any excessive contraction of the heart rate, or the heart rate is increased, then it leads to a condition called tachycardia. So in this tachycardia is a side effect of various beta adrenergic blockers. So in order to prevent the condition called tachycardia, phenylephrine is recommended. So the other drug which is used as a vasopressor is norepinephrine. So norepinephrine is, we can say, it is one of the neurotransmitter or chemical mediator which is synthesized in the body itself. So this norepinephrine, it acts on two receptors, that is alpha receptors as well as beta 1 receptors. So on binding to these alpha and beta 1 receptors, it causes constriction of the blood vessel. And the cardiac effects, what are the effects of these norepinephrine on heart? So once it binds to alpha and beta receptors, it causes increased contraction of the heart contractility, or else the contraction of the blood vessels which are present in the heart will be increased, and there will be increased heart rate or tachycardia condition. Here again we can see the effect or pictorial representation. Here tyrosine, because of the action of an enzyme called tyrosine hydroxylase, L-dopa is formed, and because of the action of the enzyme called dopa decarboxylase, the L-dopa is converted to dopamine. Here decarboxylase is nothing but removal of carboxyl group, that is COOH group from L-dopa. It is leading to a compound called dopamine, and dopamine is further synthesizing noradrenaline. So noradrenaline is also called norepinephrine. So this norepinephrine, it binds to both alpha receptors, alpha 1, alpha 2 as well as beta 1 receptors, and exerts its actions. So what are the uses of this norepinephrine or noradrenaline? So this is used in combination of vasodilation and myocardial dysfunction. So if there is any disturbance in the functioning of myocardial tissue, so this myocardial tissue dysfunction as well as in vasodilation condition, it is used, this norepinephrine is used. If or else we can say in a simpler way, if vasodilation as well as myocardial dysfunction takes place, in this combination only norepinephrine is recommended, and it is used in sepsis or septic kind of shock. So septic shock is a condition which is caused, or else the shock which is caused because of the infection or because of the various bacterial, protozoal and viral infection. If there is any decreased blood flow in the blood vessels, then it leads to a condition called as septic shock. So in the septic shock, norepinephrine is recommended. The other drug is epinephrine. So epinephrine is also called as adrenaline, and it acts on both alpha as well as beta receptors. Here the action of adrenaline on alpha and beta receptors is equal, or else we can say if it binds to alpha receptors it shows same effects, as well as if it binds to beta receptors it shows equal effects. The effects of these adrenaline or epinephrine is same on both alpha as well as beta receptors, and it is also a potent vasoconstrictor. And what are the cardiac effects of this epinephrine? So when epinephrine is binding to alpha and beta receptors, it causes contractility of the heart again. So because of the effect of this epinephrine, the contraction of heart takes place, or else increased contraction of heart will be observed, and there will be increased heart rate or tachycardia condition. What are the uses of this epinephrine? So this epinephrine is mainly used in cardiac arrest. So if a person is suffering with heart attack, or else if there is any cardiac arrest, if there is any we can say reduced functioning of the heart, then this epinephrine is recommended. Apart from that, it is used in anaphylaxis. Anaphylaxis is a severe allergic condition, or we can say life-threatening allergic reactions. So if there is any allergic reactions which are life-threatening, that condition is called anaphylaxis, and this epinephrine is recommended in anaphylaxis condition, and it is used in a shock which is caused because of myocardial dysfunction, or else we can say cardiogenic shock. Cardiogenic shock is a condition because of the dysfunctioning of the heart. If shock is occurred, then it is called cardiogenic shock. In cardiogenic shock, this epinephrine is recommended. But there are some problems while administering this epinephrine, or else once epinephrine is administered, there may be some side effects we can say. So the side effects include there will be reduced blood flow in the mesenteric region. So in the mesenteric region, the flow of blood will be reduced, and apart from that, there will be increased myocardial workload. The workload, or else the load on the heart will be increased because of the epinephrine if it is given in excessive doses. So these are the side effects of epinephrine. The other drug is dopamine. So dopamine, it acts on dopaminergic receptors as well as it acts on adrenergic receptors also. So on action of D1, D2 and D3 receptors, it exerts its effects, as well as alpha and beta receptors also it shows its effects. But the affinity of the dopamine is more for alpha receptor, is more for beta 1 receptors than beta 2 receptors. So this dopamine, it binds to beta 1 receptors more when compared to beta 2 receptors, and it is also a potent vasoconstrictor. It's not a potent vasoconstrictor, but we can say it is a vasoconstrictor only when it is given in higher dose. If it is given in normal or smaller doses, it does not cause vasoconstriction. So on higher doses only, it is called as it shows an effect called vasoconstriction. And this but the cardiac effects, or else the effects of the effect of this dopamine on heart is shown in lower doses only. If dopamine we give in lower doses, it shows cardiac effects, like it increases the cardiac output as well as it increases the heart rate, or causes a condition called tachycardia. So here the pictorial representation of dopamine metabolism. So once dopamine is synthesized from L-dopa, it is undergoing metabolism by an enzyme called MAO, that is monoamino oxidase, and COMT. So this is also the carboxy monotransferase enzyme. So on the action of MAO enzyme, it forms dopac compound. On the action of COMT, it is called as it forms a compound called 3-MT, that is 3-monotransferase. And when this dopac is exposed, or else when the COMT enzyme acts on this dopamine, and when 3-MT, when MAO enzyme is acting on 3-MT compound, it forms a common compound called as HVA. So this is one of the end product of dopamine metabolism, and once dopamine metabolism is taking place, it is excreted out of the body. Here are the various dopaminergic pathways, or as we can say the pathways where the dopamine is getting distributed in the body. What are the uses of the dopamine? So this dopamine is mainly recommended in septic shock, the shock which is caused because of the infection, and also it is recommended in inflammatory shock, that is the shock which is caused because of the various or increased inflammatory reactions in the body. So in these conditions, dopamine is mostly preferred, and it also increases urine output. And apart from its uses, dopamine also have some side effects. So what are the side effects of dopamine? So it leads to a condition called dysrhythmia. So dysrhythmia is a condition, or dysrhythmia is a condition where there will be disturbances in the rhythm of heart. The name itself indicates dysrhythmia. So the heartbeat occurs with a certain rhythm. So if there is any disturbances occurring in the rhythm of heartbeat, then it leads to a condition called dysrhythmia or arrhythmiasis. So here in the arrhythmia condition, atrial fibrillation takes place. So what is this atrial fibrillation? So atrial fibrillation is a condition where the arterial tissue is replaced with the fibrous tissue, where it is causing fibrinosis of arteries of heart. So this condition is called as atrial fibrillation. If there is any arrhythmia condition, then the person will have atrial fibrillation, and there will be the disturbances in the ST wave. If we see ECG of a person, we have PQRST wave. So if there is any disturbance, or else the duration of this ST interval is increased, or else the duration of this ST interval is altered, then it leads to a condition called arrhythmia. So if dopamine is given in excessive dose, it leads to arrhythmia condition, and it is not a potent vasoconstrictor. So if dopamine is given in shock, it is up to certain dose. If it is given in higher doses only, it is recommended. If it is given in smaller amount, then it is of no use. The other drug which is used as a vasopressor is dobutamine. So dobutamine is one of the drug which is acting on both beta receptors. It does not have any action, or else it's not concerned with alpha receptors. It only acts on beta receptors, both beta 1 as well as beta 2 receptors. But this dobutamine has greater affinity to beta 1 receptors than beta 2 receptors. And what are the effects? What are the effects of this dobutamine on vascular system? It causes vasodilation on binding to the beta 2 receptor. So if dobutamine is binding to beta 2 receptors, it causes vasodilation, where dilatation of blood vessels are taking place. And here this effect is mostly recommended if a person is suffering from blood pressure. So if a person is having high blood pressure, this dobutamine is recommended. And what are the cardiac effects? So in low doses only, this dobutamine shows cardiac effects like increased cardiac output. We can say it is a strong inotropic agent also. So a strong inotropic agent is in the sense it causes increased contractility of the heart. So those agents which causes increased contraction of the heart are called as inotropic agents. So this dobutamine in lower doses, it is a very good or a strong inotropic agent, as well as it causes increased heart rate or tachycardia condition. What are the uses of this dobutamine? So this dobutamine is mainly used in septic shock. In septic shock also, I told you there are 3 stages of septic shock. One is sepsis, the other one is severe sepsis, and the other one is septic shock. So sepsis is the initial stage, or as we can say the refractory period of septic shock. So in the initial stages of septic shock, this dobutamine is recommended, and it is also given in an inflammatory shock condition, or is the shock which is caused because of the inflammatory reactions in the body. And it is also preferred in cardiogenic shock, or as the shock which is caused because of the cardiac or myocardial dysfunction. And the main side effects of this dobutamine is it causes Tachy Dysrhythmia. So what does this mean? I told you dysrhythmia is the disturbances in the heart rate, or else the disturbances in the rhythm of the heart. Tachycardia. Tachycardia is a condition where there will be increased heart rate. The normal heart rate or heartbeats is 72 beats per minute, right? If the beats exceeds more than 100, then it leads to a condition called Tachy Dysrhythmia, where there is disturbance in the heartbeat as well as increased heart rate. So this condition is called Tachy Dysrhythmia, and it causes hypotension because of excessive stimulation of beta 2. I told you on dobutamine, when it binds to beta 2 receptors, it causes vasodilation. But on increased stimulation of beta 2 receptors, it leads to a condition called hypotension because of over or excessive vasodilation. The other drug which is used as vasopressor agents is vasopressin. So vasopressin is a hormone, we can say, or else it is a hormone which is present in the body with various effects. So it mainly has effects on vascular system, renal system and endocrine system. So the amount or else the stimulation of the vasopressin determines the functioning or else the fluctuations of functioning of these systems in the body. So what is the effect of the vasopressin on vascular system? So on vasopressin on stimulation, or as I told you, it's a hormone, right? When the vasopressin is released in the body, it causes, or else it is mainly, it plays a very important role in blood pressure regulation. We can say it causes vasodilation. In blood pressure condition, there will be increased constriction of the vascular muscles. So this vasopressin, it causes vasodilation in blood pressure in the vascular system, leading to the regulation of blood pressure, and it causes various vascular constrictions. It causes constriction of vascular muscles in the renal system as well as endocrine system, and it causes vasodilation in the cardiac system. And if vasopressin levels are decreased, so vasopressin is a hormone which is synthesized in the body. So if the levels of this vasopressin are decreased in the body, it leads to a condition called sepsis. So what are the uses of this vasopressin? So as the decreased levels of vasopressin cause sepsis, it is used in the treatment of septic shock, but very low doses are enough to treat the septic shock, and it is also causes pericardiopulmonary bypass. So after the cardiopulmonary bypass surgery, there will be the increased vascular tone. So in order to reduce that, this vasopressin is used, and it is used instead of epinephrine in cardiorespiratory arrest. So if there is any arrest, or as we can say, if there is any improper functioning of cardiac as well as respiratory system, or else there is no function of cardiac and respiratory system, instead of the epinephrine, this vasopressin is used, because the vasopressin is more effective than epinephrine in cardiorespiratory arrest condition, and it is also used in hypotension, which is caused because of ACE inhibitors. ACE inhibitors are nothing but angiotensin converting enzyme inhibitors. So these are used to treat hypertension, or these are used as antihypertensive agents. So because of the excessive action of this ACE inhibitors, it leads to a condition called hypotension. So in that hypotensive condition, which is caused because of ACE inhibition, this vasopressin is recommended. What are the effects or side effects of this vasopressin? So this vasopressin also causes a side effect called as Tachy Dysrhythmia. That is, the beats of the heart will be increased more than 100. And apart from that, it also causes hypotension because of excessive stimulation of beta 2. As it is having more affinity for beta 2 receptors, it leads to a condition called hypotension, or because of the excessive vasodilation. So here in this slide we can see the various applications of vasopressor agents. So here in septic shock, the shock which is caused because of the sepsis, the first line drugs, or as the mostly preferred drugs, are norepinephrine and phenylephrine, and the second line of drugs, if the norepinephrine and phenylephrine causes, or if a person cannot resist this norepinephrine or phenylephrine, then vasopressin and epinephrine, that is adrenaline, are used. And in heart failure, Dopamine and Dobutamine are recommended as first line drugs, and second line drug is milrinone. And in cardiogenic shock, the Norepinephrine and Dobutamine are used. There are no secondary drugs for cardiogenic shock. And in anaphylactic shock, firstly recommended drug is epinephrine or adrenaline, and the second line drug is vasopressin. And in neurogenic shock, only phenylephrine is used. And in hypotension condition, phenylephrine as well as epinephrine or adrenaline is used. So these are the various drugs, these are the various vasopressor drugs which have various clinical applications.